Okay, let's dive into a topic that might seem straightforward, but its impact is actually pretty profound. We're talking about healing, specifically the critical role of exercise in burn recovery. For anyone who's been through a burn injury or, is supporting a loved one, it's a long road. And we often think, okay, doctors, nurses, medicine, bandages. But what about actually getting the body moving again?
Yeah, and what's really striking is just how fundamental exercise is, especially during that really crucial hospital stay right at the beginning. It's not just like about getting fit again. It's actually a core part of getting back to daily life and, importantly, preventing bigger problems later on.
Right. So our mission today is to really explore how physical therapy, PT, and occupational therapy, OT, use exercise right from the start, during that hospitalization. Think of this as your guide to understanding why every single stretch, every step, every little movement matters so much for you or your loved one's healing. We'll get into how it helps with everything from like stiff joints to hand function, even things like balance.
Hmm.
So to start, let's talk about what actually happens to the body right after a burn.
hmm
It's clearly more than just skin deep.
It really is. And this raises a key question. Beyond that visible injury, how does a severe burn affect the whole system? See, when someone has a large burn, the body kind of goes into overdrive, high alert. It starts burning through energy incredibly fast. And crucially, this can lead to a significant loss of muscle all over the body.
Wow, all over, not just near the burn.
Exactly, even in areas that weren't burned. And this makes a person feel incredibly weak, just exhausted. And unfortunately, this muscle loss, it can linger for months sometimes, believe it or not, even years after the injury itself.
That's huge.
Yeah.
So the whole body feels it. And with that going on, what about movement? I've heard joints can get stiff, almost stuck.
Oh, absolutely. That's one of the most common challenges we see. Joint stiffness or sometimes severe restrictions in movement, we call them contractures. These can happen in the big joints, shoulder, elbow, hip, knee. And if the hands are involved, well, that can really impact someone's ability to do basic daily tasks.
Yeah, I can
And
imagine.
balance, too. That can be affected by a mix of things, pain, obviously, but also just spending a lot of time lying down and changes in how the body senses where it is in space. Proprioception, we call it.
Okay, so this is where the therapists come in, right? The physical and occupational therapists.
Yeah.
For our listeners who might be new to this, can you break down what PT and OT actually do in a burn hospital?
Sure. So you can think of physical therapists, the PTs, as the experts in the big movements. Things like walking, standing up, moving safely between surfaces, and working on overall balance, getting you mobile.
Like the big picture movement.
Exactly. Then the occupational therapists, the OTs, they focus more on the everyday tasks, especially using your hands for things like eating, getting dressed, maybe writing. They really hone in on what we call ADLs, activities of daily living, those essential things you need to do to care for yourself.
Got it. So it sounds like a pretty involved process. What does a typical day of therapy look like then? Is it just like a quick 15-minute session?
Oh, no, not at all. It's actually quite intensive and it's really tailored to the individual. There was a study looking at inpatient rehab, and it found patients were getting therapy from both PTs and OTs for about 3 hours a day, 5 days a week.
3 hours a day. Wow.
Yeah, it's significant. And the specific things they do, the interventions, are completely personalized based on that patient's specific goals and needs.
Okay, so what kinds of activities or maybe tools do they use in those 3 hours?
It's quite a varied toolkit. They might use scar massage, which is really important to keep the new skin flexible and stop it from getting too tight. Then there are specific exercises, some to improve how far a joint can move, that's range of motion, and others to build back strength in muscles that have weakened.
Makes sense.
They also work heavily on functional mobility. That's just a term for practicing moving around safely in real life ways like getting out of bed or using the bathroom. And gait training, which is basically helping with walking patterns. For balance, specific activities. For hands, it's all about fine motor skills, those small, precise movements.
Right.
Plus, they often use things like custom splints or compression garments. These help prevent stiffness and manage swelling, promoting better healing. Ultimately, it's all geared towards improving those ADLs, those simple things like getting dressed or feeding yourself that means so much for independence.
Okay, so we know what they do, the tools, the time involved. Let's get into the impact. What does the research actually show about how much this kind of exercise helps during that hospital stay?
Ugh, this is where it gets really interesting and honestly very encouraging. A key study looks specifically at the effects of this kind of inpatient rehabilitation, and they found significant improvements, like really measurable gains across the board.
Okay, let's break that down then. What about joint movement first? You mentioned stiffness, those contractures.
Right. So for joint movement or range of motion, the study showed patients had significant improvements. Shoulders, elbows, hips, knees all showed progress. Many patients came in with pretty stiff joints, these contractures. But during rehab, listen to this, 64% of those stiff joints improved by at least one whole level of severity.
54%, that's huge.
It is huge, and maybe even more telling, none of the joints actually got worse during therapy. Zero deterioration.
Wow.
It just highlights how effective things like stretching exercises, sometimes casting or splinting can be. It shows these non-invasive methods really work.
That really is a massive win,
Mhm.
especially avoiding potential surgery.
Right.
Okay, what about the hands? They're so critical for just about everything.
Absolutely. And hands are, unfortunately, very commonly burned. Burns can really affect hand strength, how well they move, and that ability to do small, precise things. So therapists use a test called the Jebsen Hand Function Test. It basically times how quickly someone can do everyday tasks, writing a sentence, picking up small things like paper clips, simulated feeding, stuff like that.
Okay.
And the study showed patients saw significant improvements here too. Their dominant hand function improved by 42% and the non-dominant hand by 33%.
Again, really significant numbers.
Definitely. Now, their speed wasn't quite back to, say, healthy adult levels yet, but those were major gains in regaining the ability to do things for themselves, getting that independence back.
Yeah, absolutely critical. And staying steady. Balance can be a real issue, right?
It really can be. Lots of burn survivors find their balance is off. Pain, time in bed, it all contributes. Therapists use a tool called the Berg Balance Scale. It involves doing a series of tasks like standing on one leg, turning around, reaching forward to see how steady someone is.
Okay. Measuring their risk of falling, essentially.
Pretty much, yeah.
Yeah.
And in the study, the average balance scores improved significantly. Patients went from being classified on average as a medium fall risk when they were admitted to being a low fall risk by the time they were discharged. That's a huge step towards safety and just feeling confident moving around again.
That's fantastic. So it's clear exercise is powerful for specific things, joints, hands, balance. But let's connect this back to the bigger picture. What about overall strength, getting the whole body back online after that muscle loss you mentioned?
Right, the systemic effect. Well, exercise is absolutely vital for that too, for restoring that lost muscle mass and just overall physical function after severe burns. It even helps the body manage that hypermetabolism state we talked about, where it's burning too much energy and breaking down muscle. Exercise helps regulate that. Studies, particularly in children, have clearly shown that hospital-based exercise programs significantly improve muscle strength and also what we call cardiopulmonary fitness.
Cardiopulmonary fitness.
Yeah, basically how well the heart and lungs work together. Better fitness means you can do more without getting exhausted so quickly.
Okay, that makes sense. Does this apply to adults too? Especially if, maybe, it's been a long time since their burn. Is there still hope?
Yes, and that's another really fascinating piece of the puzzle. Research with adults who had burns years ago, I mean, some were like 14 years post-injury, it showed that they responded to exercise training in the exact same way as healthy people with no burn history.
No way, really?
Really, after a 12-week program, both groups, the burn survivors and the healthy controls, had significant improvements in muscle strength, hips, shoulders, elbows, and they gained lean body mass. It strongly suggests it's really never too late to start, and those basic exercise principles work. That offers so much hope, I think.
That's amazing, and it really highlights the value of having someone guide you through it, doesn't it? Doing it right.
Exactly. Studies consistently show that supervised exercise, in a hospital or clinic with a therapist or exercise physiologist, is much more effective for building muscle strength than just trying to follow a program alone at home. That guidance, the support, making sure the technique is right, it just makes a huge difference.
You mentioned contractures earlier, the stiff joints, and how therapy helps.
Mhm.
Can this kind of dedicated exercise actually prevent needing more surgeries later on?
That's a really important question. And yes, it seems it can. Exercise training, particularly the stretching and range of motion work, has actually been shown to reduce the number of corrective surgeries needed for those stiff joints. By improving how far the joint can move, how much it can stretch, therapy can often head off the need for another procedure. It's a powerful preventative tool in that sense.
That is incredibly valuable information, especially for recovery during that initial hospital stay. But what about the long game? How long do these benefits last, and how do people keep them going?
That's key, isn't it? Thinking long term. While, maybe in the past, exercise started later, the evidence now really points towards early rehabilitative exercise training. ideally starting maybe 1 to 3 months after the burn, often right after leaving that acute hospital care. Starting early seems to lead to bigger, longer lasting gains in muscle and fitness.
So getting started early helps lock in those benefits. But do people need to keep exercising, like forever to maintain them?
Well, the benefits from those initial structured programs, they're often seen for about a year, which is great. But to keep those improvements going strong beyond, say, 2 years, continued participation in exercise, maybe starting a specific maintenance program is definitely highly recommended.
Sort of like anything with fitness, you have to keep at
Yes.
it.
Exactly. It's like tending a garden, right? You need to keep putting in the work to maintain the results. Consistent effort pays off long term.
And since every burn is so different, different location, different severity, I'm guessing these exercise programs are highly customized.
Oh, absolutely. 100% personalized. They have to be. Therapists look at exactly where your burns are, how severe they are, your overall health, but maybe most importantly, what your specific goals are.
Right, what matters to the individual?
Precisely. Is your goal to carry a shopping bag again? Or get back to gardening? Maybe lift boxes for work? The therapy is designed specifically to help you achieve those things, the activities that matter most for your quality of life.
So wrapping this all up, what's the big takeaway here? This deep dive, it seems to show pretty clearly that exercise, when guided by these skilled therapists, is almost like a superpower in burn recovery.
I think that's a great way to put it. It's not just nice to have, it's a vital first line approach. It makes a real tangible difference in getting movement back, building strength, improving how you use your hands, boosting balance. And like we said, it can even potentially reduce the need for more surgeries. It helps people get back their independence, their quality of life. It helps counter that long term stress on the body. And incredibly, can help adults years later get back towards baseline strength.
It really is a testament to the body's incredible ability to heal, especially when it gets the right support, the right guidance, and of course, the effort involved. So, for you listening, whether you're the one on this journey or you're a family member, a caregiver walking alongside someone, just know that every movement, every single exercise, even if it feels small, it's a meaningful step, a step towards healing and getting back to the life you love. And maybe just to leave you with a thought, knowing how incredibly vital this movement is for healing, for getting back function. What's one small step, one achievable thing related to movement or activity that you could consider taking today?